Let's see about the dengue fever and its complications today. Aedes aegypti is the principal vector, followed by Aedes albopictus. The vector injects the dengue virus, which is enveloped ssRNA virus having 5 serotypes Den1 to Den5 belonging to the family Flaviviridae. Pathogenesis of dengue may range from subclinical infection to dengue fever, dengue hemorrhagic fever and eventually dengue shock syndrome. Infection with any of the dengue virus serotypes may be asymptomatic in the majority of cases or may result in a wide spectrum of clinical symptoms, ranging from a mild flu-like syndrome known as dengue fever to the most severe forms of the disease, which are characterized by coagulopathy, increased vascular fragility and permeability, that is dengue hemorrhagic fever. The latter may progress to hypovolemic shock, that is dengue shock syndrome. In Asia, the risk of developing severe disease is greater in dengue virus-infected children than in adults. It is characterized by the rapid onset of fever in combination with severe headache, retroorbital pain, myalgia, arthralgia, gastrointestinal discomfort, and usually rash. Minor hemorrhagic manifestations may occur in the form of petechiae, epistaxis, and gingival bleeding. Leukopenia is a common finding, whereas thrombocytopenia may occasionally be observed in DF, especially in those with hemorrhagic signs. The life-threatening dengue shock syndrome stage occurs shortly after defervescence, which is characterized by a rapid, weak pulse that is less than or equal to 20 mm Hg, or hypotension with cold, clammy skin in the early stage of shock that is grade 3. If patients do not receive prompt and appropriate treatment, a stage of profound shock may set in which pulse and blood pressure become undetectable, that is grade 4, resulting in death within 12 to 36 hours after onset of shock. The mechanism behind this dengue hemorrhagic fever and dengue shock syndrome is based on that neutralizing and non-neutralizing antibodies produced. Neutralizing antibodies are protective in nature. Such antibodies are produced against the infective serotype, which last lifelong, as well as against other serotypes which last for some time. Non-neutralizing antibodies can last lifelong and are heterotypic in nature. They are produced against other serotypes, but not against the infective serotype. These antibodies produced following the first serotype infection bind to the second serotype during secondary dengue infection. During the secondary exposure with different serotype, antibody-dependent enhancement occurs. These antibodies produced following the first serotype infection bind to the second serotype during secondary dengue infection. Dengue NS1 AG will activate the alternative complement pathway and the mononuclear cells, the monocytes, which secretes the cytokines, namely tumor necrosis factor alpha, interleukin 6 and 10. Tumor necrosis factor alpha induces the interaction of myosin and actin stress fibers via enhancing the phosphorylation of myosin light chain and endocytosis of junctional proteins. This leads to vascular hyperpermeability followed by dengue hemorrhagic fever, hypotension and hypovolemic shock. For treating dengue fever, paracetamol is recommended for treatment of pain and fever. Aspirin, other salicylates, and non-steroidal anti-inflammatory drugs should be avoided. Patients with dengue hemorrhagic fever or dengue shock syndrome may require intravenous volume replacement.